here today in the office of Pauline Wilson and James House. Morning, Pauline.
Good morning, Stephen.
How are you?
I'm fine.
And Happy New Year.
And to you too.
Pauline, can you give people who don't know what podiatry is a brief introduction to it, please?
Podiatry is a medical specialty that deals with the assessment, diagnosis, and management of problems affecting the foot and the lower limb.
And how long are you in podiatry?
I am a podiatrist 15 and a half years.
15 and a half years, so you're no new person to this.
No.
And what's the biggest changes you've seen in podiatry care over your term?
The biggest changes that I've seen are the fact that, we have a very strong profession that's growing in numbers and growing in status within the medical community. It's now becoming a regulated profession, along with a lot of the other allied health professionals in Ireland under the legislation. So it's all positive.
And in regard to the amount of people coming in, has it changed and has the demographic changed over the years?
In the area where I work, which is in diabetes, we're certainly seeing a lot more people with diabetes. So therefore, we will see a lot more people going forward with complications. We're also seeing a younger proportion of people presenting with problems from diabetes.
And if you were to speak to the overall Ireland's health minister, what would you ask him to improve in your industry? Is there anything you'd like to see?
I'd like to see him look at the bigger picture, and it's not just about having so many nurses or so many doctors. It's about looking at the whole disease process, from health promotion and screening and support staff as well. There's only so much that, whether it's a podiatrist or a nurse or a doctor can do, they need the support staff there to be able to do that, to complete their roles properly.
And do you feel that is it being helped, or do you feel as a podiatrist is there left on the long finger? As we know, retinopathy is something that the government have put a lot of money into advertising, but yet you don't see stuff for podiatrists. And would you like to go into schools and try and roll out a program?
I think in terms of diabetes, I don't know that going into schools is particularly a good thing from a podiatry perspective. I think it's important to go into schools to tackle the obesity problems, and I think there's certainly a lot of focus in the media and programs like Operation Transformation and things certainly help in that regard. As podiatrists, yes, we're very much left on the long finger. Nobody likes to talk about their feet. I suppose your comparison there to retinopathy is that screening for retinopathy is very straightforward. It's just a photograph, whereas screening for foot problems is a lot more subjective and it's a lot more challenging. So to compare like with like, it is quite difficult. It's a much more difficult thing to do. But certainly, yeah, podiatry is definitely, we call it the Cinderella specialty often.
And anything else you'd like to add?
No.
Okay, thanks very much, Pauline.